My name is Thigpen. I'm the program director of the internal medicine residency program at the University of Mississippi, and I'm one of the counselors for the Southern Society for Clinical Investigation. And this workshop we started last year, the Career Advancement for Clinician Educators, Tactical Issues, which are more like day-to-day things that you can utilize and tools that you would need every day of your work if you're a clinician educator, or if you're at really any level of training where you're experiencing this or might be a team leader. And then tomorrow afternoon we'll have the 6th year of the other workshop that we've done for clinician educators, strategic issues, which are really more thinking about the broader picture of your career. But I think you'll find that some of these things we talk about today will also be applicable more broadly as well. So just to begin, no conflicts of interest to disclose. None of our speakers do throughout the entire afternoon. Our objectives today, these three up here, basically when we're setting expectations for learners, we want to make sure that we account for the learning environment, of course, particularly the learners, and when we set expectations, and we understand how important it is to be specific with the roles and priorities, and that we deliver expectations not just for performance, but also for mindset, which is something that I think we often overlook when we're working with learners, including sometimes our own peers. So first of all, you think about this scenario, and some of you, if you've ever attended on award service, you probably recognize this. It's late June, so it's the end of the academic year, about to be the beginning of the next. And in 6 days, you know you're going to be beginning your time on a award team that has a brand new third-year resident, so someone with some experience there, but a brand new intern, 2 brand new fourth-year medical students, 2 brand new third-year medical students, and your census normally runs about 14 patients, and normally the patients have about 3 to 5 chronic medical problems, and then 2 to 3 acute problems that are secondary to what is really a primary acute problem. So if you work in any sort of referral center, or really if you work at any academic medical center, this is probably a very common layout of what your census might look like. So the question is, how are you going to go about setting expectations for the group? So one thing that we would like this afternoon to be is a little bit interactive. We have actually a pretty small group, so there's 2 ways we can do it. One, I can just ask you the question and you can participate, raise your hand, we'll all be able to hear you. The other is to talk to your partner, but I'm going to open it up actually to the entire room here. So you think about this scenario, you've got to set some expectations for this particular group. Where would you begin? How would you go about doing it?
I think you start on day 1.
Okay.
And try to lay out clear expectations, knowing that you're going to have very different expectations for different levels of training.
Yeah. Absolutely. Day 1, we're going to come to that in just a second. It's very, very important, maybe the most important day that you're doing. Yes, ma'am.
I'm going to just say the same, like you have to make sure your expectations is different for each kind of category of learners.
Right.
Students will be different from interns, and interns will be different from seniors, and so on.
Right. Absolutely. I mean, that third-year medical student, and this is maybe the first time that this person has actually walked through the hospital floors even and gone in to see a patient where it actually meant a little bit more, like they were taking information that was going to be valuable for the team. They might have done it as a first or second year student, but only when it was just valuable to themselves. But very different from the resident who's going to be writing orders or overseeing the entire team. So totally different set of expectations. Yeah.
I think it would be nice, like, you know, in light of the fact that you have days to kind of send them some information about like what expectations are and what their roles are going to be.
Right. Yes. Great point. And in fact, and we're going to come to that here in just a second. And I'm also we're going to do a little bit more interaction in a little while. But just to give a little bit of background about this and the rest of our session here before we go back to the scenario. So it's been about 6 years now since a group of us at our institution did a workshop series for our faculty called Becoming a Superior 2-Hour Teacher. And we broke it up into 4 segments. We're actually going to talk about each of these 4 segments this afternoon. The first of those was setting expectations, and that's, of course, where it all begins. It begins with setting expectations with accounting for the learning environment, which a few of you have already talked about. So day one was mentioned, and day one is the most important time that you will spend with your team at any point during the experience, whether it's going to be 1 week, which some people do now, whether it's going to be half a month, which a lot of places, the attending is with the team for half a month. It might be an entire month. And in the clinic, it might be 6 months or a year. But day one, the first time that you work with that set of learners, whatever set of learners it's going to be, is the most important time. That's when you're going to set the tone. And yes, you can go back and you might be able to modify and change things or add things that you left out, but you're not just, it's not just the actual things that come out of your mouth and as far as the expectations go. It's how you say them, what you say. This is your best chance to make that first impression. It's also true that right there on day one, that the expectations need to come out right then, or as someone mentioned before, here in a minute, I'm going to show you maybe when that ideal time might be, but I'm not sure if any of you are familiar with this book. It's going to get referenced again in another talk this afternoon. But this is a book written by the Gallup organization. It talks about, they are also the authors of the book First Break All the Rules, which a lot of you might have heard. But the book's entitled 12, and it's the 12 elements of great managing. And it has them listed in order. And really it's the 12 things that employees really want the most out of their managers. And number one is they want to know what they are expected to do. So there is nothing more unsettling to an employee or to anybody who's working with another group than not having any idea what's expected of them. So very important to lay that out. So it was mentioned, when is the best time to do that? Now this is a calendar for this month, which is a little bit different than the month I laid out before. But at our institution, we often will start on the 28th of the month. But of course, that's a shorter period of time with the outgoing team this month than it is on other times. But we might start the 28th of June instead of the 1st of July. But when you're and the team, the rest of the team might change over on the 1st of July. But either way, anywhere from 3 to 6 days prior to that time that you're going to actually begin with the team, it is a good idea, as was mentioned, to send them some advanced communication. I don't know if any of you have read the books that David Rock has written. He's written 2 that I've come across. One, Your Mind at Work, and it talks about how much we can actually store in our active memory versus what we need to have kind of set or already embedded. Another book that he has written is called Quiet Leadership, and in that book he points out that people do much better, and this sounds so common sense, they do much better when they have time to process the information before they actually have to act on it. So you've probably been to a meeting where somebody came in with about 30 documents and dropped them in front of you and asked you to review all the documents, and then we're going to make a decision during this meeting. And you probably found that to be almost impossible. So when you come in on day one, if this is the first time that the team has heard the expectations, and they might have actually already gone and seen some patients that morning, and they're already thinking about what they might need to be doing for those patients, it will be harder for them to process the information you give them at that point than it would have been had you sent it to them days in advance where they could read over it and read through it and digest it. And you know that they're not all going to read it, right? But you can at least hope that some of them do read it, as long as you encourage them to do it. At least you've given them the opportunity to process that information. So sending some information in advance really is a sign, too, that you have an appreciation for what the environment is going to be. It sends a signal to the team that you understand what you're about to go through and work on together. Another big part of understanding the environment is where are you going to be? And I know that we started off with an example that was the inpatient ward service, but we've also mentioned clinic. Very, very different environments. In the clinic, the schedule is really fixed. The patients are going to be there at a certain time. They're going to be there for 20 minutes, 30 minutes, at the longest an hour, we hope, if it's a brand new patient. To somebody who hasn't had a lot of experience seeing patients, you're just going to have that one opportunity in front of the patient, this snapshot. The patient's going to walk out the door and you're not going to see him again for several months. You might have a clinic with late arrival policies where they get the patients push the boundaries of that, and you have a patient show up a little bit late and someone who's further down the schedule showed up a little bit earlier. So giving expectations for that would be very different also. And then you're only going to work with one learner at a time. The learner's going to come sign out to you, and then you're going to go in the room together, It's very different from working with a team where you've got 6 or 7 people and you're talking to all of them at one time, trying to teach and instruct all of them at one time. Of course, in the hospital, you can go back to the room over and over and over again, and you can see the results of the things that you ordered, and the patient's still there for you to go talk to the patient about it. You don't have to reach out to them or call them on the telephone. However, you do have different kind of pressures, whereas the schedule in the clinic might have been a pressure. You're getting pressure probably from the hospital on a daily basis to discharge the patients. The patient might be giving you some pressure to discharge or not discharge him or her. And then I've already mentioned that you'll have all the learners at once. It's also important, of course, to understand who is your team, who is this group that you're going to work with. We've mentioned some of this already about, is it multiple levels, are they brand new, are they seasoned, do they grow up here, have they been in this hospital system before? This intern who's about to start on July 1, did that person work somewhere totally different for years and has never worked with your electronic medical record before July 1 when they walk in to sign their first orders? Is anybody struggling on the team? That's also important to either know or try to know or find out. Some it might become very obvious after you've been working with them a little bit. Some it might be rather silent. But if there's a way to know beforehand, that really helps you prepare a lot better. You also want to know who's doing very well, because you're going to challenge them in a different way. You might even lay out their expectations in a slightly different way as well. But no matter what the answers to those questions are, it is a near certainty that you have never worked with this same group of people in this particular environment with you. You might have worked with 1 or 2 of them. Perhaps you had a couple of them in clinic already the previous year, but now you got new people coming in the clinic on the same half day. This time that you're about to start, probably the first time that all of you have actually been together. Time. And that word's already come up several times to this point. But really, this too, as important as it is to understand where you are and who it is that you're going to work with, it's very important to understand time and how important it is, not just to you, but to your patients who probably don't want to be in the hospital or might have somewhere else to go after clinic, to your learners who will need to get the things done that you're actually talking about on the rounds, or they might have conferences or other educational obligations that they have to meet. If you're in a system where you do clinic and they're doing inpatient work at the same time, there might be time pressures to get back to the hospital. It's important to understand the time of day. Morning clinic is very different from an afternoon clinic. Morning rounds are different from afternoon rounds. The number of days that you'll be together and who's going to be off when. And really, accounting for each of these things when you deliver expectations is very important. And as we get closer to the end, if we have time, I'm going to give you just a little bit of a sample of how we've tried to address that at our institution, or how some of us as instructors have. All right, so accounting for the learning environment, of course, is very important. It's also important and a big objective to understand the need for specificity in establishing roles and priorities. So going back to the book that I mentioned earlier, the 12 book that's written by the Gallup organization, they give a great example in that book of a place where the roles are laid out very clearly on an aircraft carrier. So aircraft carriers are phenomenal places. It is very rare, actually, that there is a major accident or injury on an aircraft carrier. Yet you have this very large ship, and you have very big planes moving at very high speeds, landing on a very short runway in the middle of the ocean. Yet, remarkably, there's not many explosions, there's not many accidents, not many deaths, and that's because everybody who works in the aircraft carrier has a different color uniform that they wear that aligns with their role. So you don't have to go up and ask somebody, what it is, what their job is. You can see by the fact that that person is wearing a yellow outfit what their role is supposed to be. And you might be wearing a purple outfit, and somebody else a red outfit, and somebody else a blue outfit. And just by the visual of that, and especially this is important in a place where there's so much noise and other things going on, you will know what that person is supposed to do instead of having to go up and speak about it. And then they also talk about defining priorities very clearly as well. And the little subtitle up there says, do the hard jobs first the easy jobs will take care of themselves, although I would caution you in actually saying that out loud, because there could be some misinterpretation about what a hard job and an easy job actually is. So I don't know about any of you, but I'm a big football fan, and when I grew up, I was just absolutely obsessed with the National Football League. So Bill Walsh is the man sitting there in the middle. He was the head coach of the 49ers in the 1980s. They won 3 Super Bowls with him as the head coach. When he took over the 49ers, they were a mess. They won 2 games the first year he was a coach. They won 6 games the next year. The next year, they won the Super Bowl. And what he talked about with his players often, very frequently in the meetings with them, he talked about how each of them was an extension of the other. So, the job that the right tackle did, he was doing that job for the right guard who was on his left side and the tight end on his right side and the running back who was behind him. And if he didn't do the job, the running back couldn't run through the hole. They couldn't have success in play. And they knew that this was important not just on the field but off the field. So one of the things that's very important for your learners to hear at the start is they are an extension of each other. They're all on the same team. So what the third-year medical student is doing is going to impact the third-year resident, whether he or she thinks it is or not. It's going to impact the attending whose name is on the chart. It's going to impact actually the nurse for that patient. It's going to impact the social worker, the case manager. Everything they do, they are an extension of each other. They can think of themselves as basically having almost like a wave effect. And once your learners understand that, then you can get into what each person's role is. So you might know who Pat Summit is. She was a legendary coach for the University of Tennessee women's basketball team, won multiple national championships. And so at various times as the coach, she had to be she had to show pleasure with what her team's performance was. She had to be encouraging. She had to give them the look on the bottom left that said, you know what you should be doing. Had to help them calm down, and sometimes had to get onto them and tell them what they should be doing or give them immediate feedback. I know it's different on an athletic field than it is working in a hospital or in a clinic, but the analogy does carry over. So what does the coach do and not do, though? So the coach does establish a frame of mind for the team, does connect with the players. That is absolutely essential. And so that's why on the first day, it's always a good idea to take the time, even if it winds up taking 6 or 7 or 8 minutes and you're thinking this is valuable rounding time, to ask everybody on the team, where are you from? Tell me about your family. Where did you go to high school? Where did you go to college? What do you want to do when you finish with medical school or with residency? Now the coach does, as we've already alluded to so far, define roles and set priorities. The coach equips the players with an understanding and acts intentionally. Everything that the coach does is being watched by all the players. Everything that an attending does is being watched by everybody on the team, every learner on the team. And everything that upper-level resident does is certainly being watched by the intern and the students. But what does the coach not do? And this definitely carries over to what an attending does not do. The coach does not sort out the team on the court. The coach doesn't go out there and physically tell everybody where to be. Maybe in practice it did that, but once the game actually started, the coach doesn't go out there and do that or play the game for the players. Best thing the coach can do is just stand over on the sidelines. The players actually have to play the game. The attending doesn't write orders, right? The residents write the orders. The attending doesn't make all the decisions. The residents need to make most of those decisions. And in some cases, the attending will need to make a decision. Just like in a game, the coach will need to make some decisions that set the tone for the team. The coach also does not make many acute decisions. It might seem like they do. They might decide to call a timeout and drop a play, or use a timeout at a certain point in the game for other strategic reasons. But actually, the acute decisions, the real-time decisions are happening with the players, happening with the residents, with the students, or the fellows. And certainly, the coach doesn't prevent every mistake. There are times when it's important for the attending to let a mistake happen, knowing that it's not going to cause any harm to the patient. And that's really hard to do. And often one thing that junior faculty members, and even some who've been doing it for years, struggle is letting the resident carry out what it is they plan to do, knowing that it might go wrong, but knowing that it won't harm the patient at the same time. So when you lay out your expectations to your learners, you could say, I'm the attending, I'm like the coach on the team. The resident, the upper level resident, and by the way, this is Dr. I give a lot of credit to Dr. Henson, who's right here in the front row for this analogy, because he's going to give the next talk, and the expectations he delivers to his team are very, very similar in the sense of roles as this right here. Your upper level resident is the quarterback, and is the leader among the trainees, and it's very important to identify that. Or if it's a subspecialty service, the fellow is the quarterback, and maybe in a slight, subspecialty services can be slightly different because the fellow might have a lot of clinic obligations. It's important to identify who's that best upper level resident to be the quarterback when the fellow can't be there as well. It's really important to talk to the quarterback, and the coach better talk to the quarterback before the game about the game plan, right? So talk on the phone, in person somehow about the experience, and then really give that upper level resident or that most experienced trainee some real responsibility. Tell them in front of the team, you are the leader of the team. This is your team. This is John's team. This is not my team. I'm here as an advisor, a coach. And yes, at times, because my name's on the chart, I'll have to make some decisions. But this is John's team. So you need to go ask him the questions that you have first. And then, of course, make the quarterback your primary point of contact. So at the end of the day, when you got to go back through the patients, don't call the intern or the students. Talk to the resident. Make sure that they feel that responsibility. So the players, it's very important to acknowledge every person on the team, even the people who are not in the room, because they are also on the team. So that first day, you're often in a team room of some sort, and you're talking about the way the month is going to go. So often the case manager is not in there, the nurse isn't in there, the respiratory therapist isn't in there, the physical therapist isn't in there, but it's important to acknowledge that they are also a part of this team. This is a multidisciplinary healthcare team. And make sure everyone knows what their specific responsibility is. The M3s are the ultimate learners. They've got the time now. This is the time for them to use to just really get to know everything there is to know about the patient, everything there is to know about the disease process, and then be responsible for that when rounds come around and it's time to discuss. Establish lines of communication. Work it up the chain, so to speak. If you're the fourth year student and you have a question, go ask the intern. You asking the intern forces the intern to learn how to answer that question. And if the intern doesn't know, go up to the resident. All of it eventually, when there's a decision made, needs to go through the resident. And then lay out all the details of your interaction. So, what time are we going to meet and how's it all going to go? We're going to come to that here in just a second right now. So before the players can really understand the playbook, and I would call the playbook actually what you're actually going to do with the patient's complex medical illnesses. How are you going to actually take care of the patient, execute the plays? That's the plan, right? But before you can even get to that point, everyone has to understand the situation. So in the hospital, these questions need to be answered with expectations. When will we round? How will we round? Are we going to see everybody every day? You don't have to do that, really. And I would say that on rounds, really, they are certainly important for patient care, but they're really important for education, and that's what separates rounding there with that team from just having them take care of patients at another hospital, which some of your residents might be able to do on their own. That the educational value of rounds is really what separates it from rounding at a separate place. Here we're going to see first, and then next, and then last. So if we run out of time, we can't get to somebody who's going to be the ones left for the attending to go see on their own, independent, and then touch base with the resident later. How long do you need to present? And this is really important. Otherwise, you're going to get to patient number 2, and you're going to be on 1 hour and 45 minutes in the rounds, and you're going to realize, I'm going to be seeing 12 patients on my own when this is over. That is not good for the patients. It's not really good for the quality of your teaching. It's not good for you in your own time. What should the presentations contain and what should they not contain? And of course, we're going to talk about feedback later on, but it's really important. You might say it at the start to be constantly giving feedback and reminders of expectations after you deliver this. Who's going to make the decisions, which we've already talked about some, and then how do we handle interruptions? So I think it's really important to address, especially to the intern who's going to receive maybe a lot of pages or text, however your hospital works that. Is it okay to break away from rounds and go answer? And I think that might be a little less common, that fear of breaking away from rounds now than it used to be. But sometimes you'll run across a learner who's so worried about missing something with rounds, or that this is going to impact their evaluation, that they will be afraid to go respond to a patient's immediate need. Clinic's a little bit different. And this is, for a lot of residents or interns when they start now, they really haven't had much clinic experience because a lot of hardships now are very hospital-based because of either because of medical school class size or just the needs of the facility. So should I type while I'm talking to the patient? Who's going to make the decision? Am I going to make the decision, or do I just leave that up to the attending about the plan? Can I tell the patient the plan before we actually discuss it? Can I write some orders before we discuss the plan? And you'll find that this is very variable, and you as an attending, as you move along that spectrum of supervision and autonomy, will feel more comfortable with the answers to some of those. Are we going to see every one of those clinic patients together? That's something that we'll also talk about later this afternoon. How long do my presentations need to be? This might be very different in the clinic, where there's a lot more tighter time pressure than the hospital. And what should presentations contain and not? All right, and then just to go back to some of the priorities. So in some of those answers, your priorities are going to become pretty clear. But it's also, there are going to be other things that you need to say and establish as priorities that might not be clear from those answers. So what is the most important thing that we are going to do together as a team? And that hint is reality. So the most important thing is we have to deliver safe, effective, high-quality care to the patients. And of course, that's impacted by all sorts of variables. But in the end, no matter how we go about getting to that point, that's what the patient needs to experience on the end. Safe, effective, high-quality care. The patient is the priority. And then the next most important thing. So that might be a little bit different depending on who the attending is or what the needs of your learners are. I think this is where it can be tailored to the team. If you have a team that's a little more experienced, it might be more focused on just figuring out how to apply the knowledge that you've already got. You might have a group of learners, though, that are really lacking in knowledge. You need to grow the knowledge right at the beginning. And then, of course, everyone should be working effectively in an interprofessional team. That needs to be a priority as well. Really important to say these out loud and put them in writing. People will forget what you tell them as far as your expectations. And remember, if you aren't specific with the expectations, if you aren't specific, you cannot hold your team accountable for being specific later. So, for example, if you don't say at the start, you need to say the vital signs, the actual vital signs when we go and we round. And you just say, make sure you do a thorough exam. Let's say you just say that anyway, or instead, rather. You say, give me a thorough exam. The other way you could say it is, give me the specific vital signs and then give me anything on the exam that has changed from the day before. So those are two very different types of expectations. And with the latter, if the vital signs are not getting presented, you can actually go back later and say, you can actually stop them even in the middle of the presentation and say, remember we talked about the vital signs, you need to make sure you're giving them each time that we actually go through. And ultimately, if they don't, that can be reflected on their evaluation as well. Okay, so last, now that we account for the learning environment and understand the need for specificity, it's important to deliver expectations not just for performance, but also for mindset. All right, so you've probably encountered this somehow, some way. So it's the 8th day. You're on service for 16 total days. Let's say you're July 1 to 16. And the intern finishes a presentation. And of course, it is early in the intern year still, of course. This patient is just too complex for me. I don't know what's going on or what to do next. And they kind of just throw their hands up. All right, so what do you think leads to that happening? And that's a question for the room. What do you think leads to the intern feeling that way or saying that? This is an intern. So what do medical students make big decisions, typically? Final decisions? All right, so that's one factor. Medical students really don't have to make the final decision to begin with. They might have always relied on somebody else to make a decision. Any other factors? Upper level's gone? Yeah, they might feel overwhelmed. Might feel a bit overwhelmed.
Nobody's taught them how to think.
Yeah.
They're complex patients, but the approaches, like everything that's hard, break it down, small steps, little things, high priority, low priority. And clearly, they're coming out at that point, they don't have a handle on kind of thing.
Right. That's very important to remember when you start an experience with a group of learners. You can't assume that the learner walks in already knowing how to think through something that is complex, or that they have the confidence to even be able to do that. And really, that might be true no matter how they might have performed objectively on any sort of test before. But especially for the students who might have struggled in medical school, or who struggled on some objective assessment of their knowledge, they're more likely, I think, to get to this point a lot faster and say, I just don't know what to do next. So what expectations can you give at the start of the month that could reduce the chance that those statements occur? So one thing you could say, I don't know if any of you are familiar, you're going to hear about it later, the 1-minute preceptor, which is used in clinic typically, and a big portion of that 1-minute preceptor, which is made up of 5 components. To me, the most important one is make a commitment. You lay it out at the start. No matter what else, when you give a presentation, you need to commit to a plan. You commit to something. Give us a starting point for where we can learn. If we have no starting point, then because of time pressures, often that's when the attending just winds up making the decision and nobody learns anything. So make a commitment. And as soon as you do, you're going to get feedback and you're going to grow faster. You're either going to be affirmed that that's correct, and here's why. That's what you've thought through and laid out here is right. But or you're going to be told, well, let's rethink this. Let's take a step back. Let's start to unwind what you said. But it's very important to lay out that you expect them to attempt to think through each of the problems, break it down, as was said just a little while ago, break it down into small bites if needed, and walk through and make a commitment. So this book is actually by a sports psychologist named Stan Beecham, and it's going to come up again later today, or tomorrow rather, if you come to that workshop tomorrow. So he worked with the University of Georgia when Vince Dooley was the coach back in the 1980s, and he worked with Tubby Smith when Tubby Smith coached basketball at Georgia, and he's worked with distance runners at Arkansas and Olympian distance runners as well. And what he points out in this book is really true for our learners too, is that oftentimes, we all have this set of beliefs about ourselves, and often that set of beliefs is based on just what 1 or 2 people might have told us that they thought was true about us, and for whatever reason it got stuck in your mind that this was true about me, or it might have been based on the performance on a test, like what was mentioned earlier, or some other experience. And they never really sat down to think and really evaluate, why do I have this set of beliefs about me? So here's an example. I'll never be better than average among all of the residents who are here. So if I can just get to average. Well, if that's what you believe you're going to get to, then you're not going to get any better than average. So encourage your residents, your learners, to recognize how little they know about their true limits, and then to think with no limits. Reevaluate what their belief set is about themselves if you feel like that's where they're struggling, or just encourage them to do it anyway, and then think with no limits. If the resident or the intern or the students believe they can't figure it out, then they're not going to figure it out. Help them believe that they actually can do it, and remind them medicine is about discovery. I mean, there are so many instances in the past of medicine where nobody knew what the answer was, but somebody sat down and thought it through really well and figured it out. And that somebody wasn't necessarily number 1 in their class. Who knows? Nobody knows, and nobody really cares. They figured out the answer. So, but as before, if you don't say or write down what you expect, you can't hold your team accountable for it. So this is talking about the actual delivery. So I alluded to this earlier, but when you actually deliver the expectations for performance or for mindset, you need to say and or write it down, preferably both, so that you can then hold your team accountable for those expectations later. And you need to deliver it with conviction. So not with anger or, like you're coming down with a hammer, but don't soft pedal it either. Don't say, I need you to try to get all the patients seen before you go to morning conference. It needs to be very clear. Everyone needs to see their patients before they go to conference, and the team needs to conduct work rounds led by the upper level resident or by the intern if the resident is not here, before morning report. Workarounds must happen every day. So, I mean, just lay it out there where it's very clear, there's no question about it. Otherwise, there'll be some doubt. You know, when it comes time to give feedback and you're wanting to give feedback or you're wanting to evaluate on a certain level, they might say, hey, that's pretty unfair. You never told us that we had to do that. So deliver it with conviction, no half measures. And then also, I do think it's very important actually to incorporate the ACGME competency language can be feel kind of heavy and onerous and difficult, but I think it's important to get everyone on the team comfortable with it as well, because that's really what ultimately, when they're being assessed for promotion, when a learner is being assessed for promotion, and now this is even becoming true for medical students as well, it's in terms of the competencies, and I think it's really important for the learners to understand that. Some of those being very intuitive, but one of them that often comes up as a question actually is the practice-based learning improvement. What does that actually mean? Well, that's how receptive are you to feedback and how do you respond to feedback? But then how do you take what you learn from this patient that we talked about today and apply it to the next patient that you see tomorrow? All right, so last thing to say before I turn it over to Dr. Henson for our next talk is it's really important to go back and reflect on the job that you did setting expectations. It's important to reflect on any experience that you have with learners. But what was my process this time? How did it go? Did I deliver it well enough? Did I find that later on in the month I was wishing that I had said something else back at the start? Take some notes on that. Go back and modify. If you have an expectations document, so I said I would mention this near the end. But at the beginning, something that I like to do, and I know Dr. Henson does, and several of our other faculty do in Mississippi, is 3, 4, 5 days before the rotation begins, send the team a document that has your contact information up at the top, and that you're available at any time that the team needs you. So you would definitely want to drop that barrier, where you're always available, and then go through and person by person describes the roles very specifically. And then talks about here's when we're going to round, here's how long we'll round, we'll never round through conference, remind me, give them the ability to remind you that you need to finish because you said you would before, so that they're more comfortable with that. Here's what you need to say in your presentations. Here's the material you can use for extra reading. Here's something that I might do that you can expect me to do during the month, and that is to ask you to talk about a certain topic the next day, and if I ask you to do that I expect you to be able to do it the next day. And so on. And then, summing it up with your priorities, making sure your priorities are listed out that weren't mentioned by answering all those other questions at the start of the document. So it's something that we typically do. And then go back and review that. Did I leave anything out? Was it not received very well? Do I need to change the format of that? And then think too about your psychology. How did your expectations and the responsiveness of your learners affect your own psychology about your performance? And then you can tailor that to play towards your strengths and also to recognize where your weaknesses are that might need to be more aware of next time. And then if your own notes don't help avoid you getting into a rut in any way, you can always ask somebody else, what are the residents saying about my performance? And because they probably have heard something about it, and just ask them to be honest with you. Pick out somebody who's going to give you the honesty. So